Hi, Ashley.
Hey, Dr. Pejic.
How are you today? And
Good.
where are you today?
You like my fancy digs? I
Yeah,
am hanging out at the Antonine Street office of Atlas Psychiatry. I'm in Dr. Andrew Anson's office today. So he's
nice.
our psychiatrist and our psychoanalyst.
That's fantastic. It looks like a psychoanalyst office. Very fancy.
So I know, I love it in here.
Yeah, very, very, very nice. So, what you got for me today?
All right, today I'd like to ask you, what are some things people can do if they feel like their medication isn't effective?
That's a great question, and that's part of what we do here at Atlas Psychiatry. So, I have about 6 things to consider, 6 tips, if you will. The first would be their diagnosis. Sometimes folks who come in for depression actually have like bipolar disorder and they're misdiagnosed, or they have borderline personality and they need a different type of treatment. The treatment for that can be a mix of medication, but also dialectical behavioral therapy. So we also have patients who have anxiety, but it's because they can't focus and they actually have ADHD and they need treatment for that. And somehow the doctor they were seeing didn't work it up all the way or got missed along the way. So we really like to get it right here. Aside from that, number 2 would be therapy. Sometimes medications just get you as far as it's going to get you. And if you've had trauma in your life and you've never processed that in therapy, then trauma therapy is indicated. Also, there's cognitive behavioral therapy, which works probably as effective as many medications, and many patients don't know that. And we provide those things here as well. So always think about the therapy. Sometimes you're in a relationship and you're living with somebody, it's just not going well, and you're anxious because there's a reason to be anxious, and you can't medicate that out of somebody. You got to say, hey, man, you got to get into some couples therapy to work in your relationship and really heal whatever wounds you got to heal and to patch it all up. So there's that. The third tip would be your lifestyle. So a lot of times folks are drinking too much. They may be using some excessive amounts of marijuana or cocaine or something. I have patients who will use too much caffeine and they don't know that they shouldn't be doing that, or they're doing pre-workout plus caffeine pills, things like that. On top of that, not exercising, not taking enough time outside of their work to do things for themselves. So there's a lot of things outside of medications that I will encourage patients to do to really move the needle in their mental health. The fourth thing to consider is if someone's on a medication, there's different classes of medications for different conditions. For example, for anxiety and depression, we use something called SSRIs. But a lot of times patients don't know that there's SNRIs. And then there's atypical antidepressants we use for anxiety and depression. And sometimes we even use antipsychotics for anxiety and depression. But the patient's not expected to know any of that. The doctor's responsibility is presenting these options. And sometimes doctors are just trained in only a couple categories, and they're not, willing to switch out of those because they just either don't know about it, or they haven't been keeping up with the literature and they don't present it. So that could be a problem. The fifth tip would be genetic testing, which is in line with switching medications. We do genetic testing here because sometimes folks, their genetics are making them eat up their medications too quickly, or the medicine they're on may not work as well in their brain because their serotonin receptors that they inherited are different, or they call them serotonin transporters. And then on top of that, we have some patients who don't metabolize folic acid normally, and that can be a problem. And they don't even know what's going on. So sometimes we do genetic testing to do that more personalized approach for their medications. And then the last thing I would say is there's some patients that are simply treatment resistant, meaning they've done multiple different medication changes, they've done multiple different therapies, and they're just not getting well. And the diagnosis is correct. They've been in treatment for a while. And the answer for that is doing something like electroconvulsive therapy, which you have to do at a hospital. Or we have 2 options here, which is ketamine therapy, which is very effective, or transcranial magnetic stimulation, which is very effective for the right type of patient, I should say, the right diagnosis. So those are 6 tips that I hope would be helpful for anyone listening. Their medicine's not working.
Okay. So if a person feels like their medicine isn't working, what's the first step? They go to their current psychiatrist and they talk about it.
Yeah, the
What
first
should
thing
they
would be to, well, that's tricky because, some providers, they are only alone in their practice and they don't have a full team to refer to. And if they refer across town, sometimes patients may not do that. Depends how fervently the doctor gives a referral, let's say for therapy or something, right? If the doctor's not advertising doing genetic testing, doesn't offer ketamine therapy, ECT, or not ECT, but transcranial magnetic stimulation, they probably just work within the purview of just the medicines they know
Mhm.
and the therapy they know. And they may want to go to an advanced center like we are for a second opinion. But if they're going to have a conversation with their doctor, I would ask them, hey, doc, do you think my diagnosis is correct? They could ask their doctor to give them a patient health questionnaire, which is a depression screening, or a generalized anxiety disorder 7 questionnaire that's called GAD-7, where if the patient fills it out and they're testing high on it, they need to show their doctor and say, hey, man, I'm not well. And it shouldn't be just a situational thing like I lost my job on Friday type of thing,
Mhm.
It needs to be like I've been this way for 2 or 3 weeks or longer and this medicine's no longer working. Sometimes like you come in to see a doctor and you're chit-chatting about what you did on vacation and what are you doing this summer, rather than saying, all right, so what levels of your depression are you at? How many hours are you sleeping? What's your lifestyle like? Um, so asking the doctor about diagnosis and maybe filling out those 2 forms can grade your depression and anxiety to bring more clarity to the situation. Other things, simply asking the doctor, what else can you offer for my anxiety or depression? Is there anything else? A lot of times I'll have patients who never tell me they're unsatisfied with their medication until I really uh, zero in on it and say, hey, like your ADHD medication, you're on this medication, but you're really not performing as well in school. Like what gives? Like, are you partying too much? Are you going through a breakup? Is the medicine just not working anymore? And they won't tell me, I'll have to hunt for it. So the opposite can work though. If you're unsatisfied with your treatment, tell your doctor, say, hey, I don't think it's working. Um, the only caveat to that is sometimes the medicines get people halfway well. And if they change that or taper off of it, they'll see how bad they would be off the medication.
Mhm.
And that's kind of a tricky thing, but the doctor really needs to be the one to worry about that. Um, yeah, those are good places to start. And if you have a conversation with your doctor and they really don't have anything to add or different options, most doctors would, you would think, have other options. Then they may just do a second opinion. And I'm always okay with patients doing the second opinion because it really sharpshoots what I have done for them already.
Mhm.
And I've had cases where folks have gone unbeknownst to me, to do a second opinion somewhere, and then they come back and they go, "Yeah, they said you were right," or they said, you know, um, you, the therapy that I recommended that they didn't want to do is probably necessary, that type of thing. Some folks just want a quick fix when it's like, hey, you got to do some more extended work on yourself, or you got to break up with that guy or that gal or whomever.
So people shouldn't feel bad about seeking out a second opinion.
No, I mean, they're the customer. It's like going to a different restaurant and feeling bad that the maitre d' at the other restaurant's going to feel bad. If they're not cutting the mustard, I think you can certainly try another restaurant out. Why not doctors?
Mhm.
Now, the only caveat to that I should say is if you get prescribed medicine from another doctor, like doctor number 2, doctor number 1 might see that in your pharmacy record. If you come back to see them, you may have to have a narrative of like why you did what you did. Or like, hey, I transferred to this other doctor for a second opinion. I tried this medication, but I want to come back to you and reestablish with you and you manage it. There should never be 2 cooks in the kitchen typically.
Mhm.
A good thing to do is to tell your doctor, like, do you mind if I get a second opinion? If so, who do you think I should get it from? They'll be like, oh, go see my mentor, that I trained under 25 years ago, and then they'll send them there. So that's totally allowed.
Right.
Yeah, that's good stuff, huh?
That is really good. I like how you talk about doing the screeners, because I talk to people a lot and they're so used to feeling just a little anxious or a little depressed all the time. Like feeling bad is their baseline
Yes.
until they really see it in numbers of like, oh, I'm really not feeling well. And I didn't think it was that bad. So I like,
and you being our onboarding coordinator, a new patient coordinator, you get to see all that. And, you meet somebody who's, well, exchanging pleasantries at the front desk. But if you see those forms as you do, sometimes, right, that they're suffering internally way more than they might let on.
yeah, I think these are all really great tips.
Well, great. It was really great talking to you. Are you going to take a nap on that couch behind you? What's going on over there?
I mean, don't tell my boss. No, I will not.
I hear he's pretty nice. He probably won't mind.
No, he's pretty cool.
All right. Thank you. See you next time.
All right, thank you.
Yeah.